The treatment of acquired brain injury within the criminal justice system, an application for continued assessment and treatment. Acquired brain injury is a disorder which can exhibit symptoms of erratic and disagreeable behaviour, but is not a psychological condition. ABI is indicated at a much higher representation in the prison community than in the Australian population, with 42% of male prisoners and 33% of female prisoners affected by the condition, compared to 2% in the Australian population. Evidence shows connections between ABI and violent offending. If not treated, reoffending with a likelihood of further incarceration is likely to occur. According to the Victorian Ombudsman, due to the lack of qualified staff, it is difficult to make such diagnoses and treat accordingly, a consideration echoed by the Royal Australian and New Zealand College of Psychiatrists. This is especially so due to a deficiency in understanding ABI within the criminal justice system, indicating that recognition of an individual's condition may be overlooked and not addressed. To address this scenario, it is necessary to develop training in the recognition of ABI by all criminal justice system staff. Funding is a necessary consideration within the criminal justice system. It is also important to consider how reduced recidivism and a decrease in criminality generally impacts upon society and so reduces the hidden costs of law breaking, such as social anxiety, increased need for personal security, etc. Clearly, there is a misdiagnosis of some of the prison population due to the difference in numbers of those incarcerated and those not in the criminal justice system. This suggests inappropriate treatment, both medically and physically, which in turn can lead to further challenging behaviours from the affected individuals. Depending on the offence, it would be beneficial to conduct better assessments of those charged with offences related to challenging behaviours in order to ascertain whether the individual was experiencing a mental health episode or if the behaviour is related to ABI. The graph shows the increase in the prison population since the 1960s. Given this a context, the cost of incarceration of an individual is around $100,000 per year, and it is acknowledged that those with an ABI placed in custodial care are likely to reoffend upon release. It is clear that the $100,000 per annum has not solved the situation and has elicited another $100,000 per year should the reoffender be returned to a custodial environment. Additionally, up to 30% of corrections costs are related to inmate healthcare. Clinical care reduces the cost of the ABI individual's treatment as incarceration, with more focused attention on the condition than directly punitive action, assists in their community integration, creating further benefits both socially and financially. Funding for initial actions after entry into the criminal justice system must be government funded, with some private agencies taking over parts of the process. Screening and assessments, however, should be undertaken by research bodies such as RMIT Centre for Innovative Justice, in order for there to be clinical experience gained by the assessors and so increase experience in this aspect of the healthcare field. Funding can be undertaken by grants to universities to engage in the research with treatments for those found to be experiencing ABIs carried out within university research programs. Success then can be measured by the reduction in numbers of those within the criminal justice system and the increase in those who have been through the criminal justice system's initial assessment, now in treatment or have completed treatment, and reduction in suicide rates and self-harm pre- and post-release. Additionally, reduction in recidivism by those within the ABI cohort can identify the benefits that may be accrued by the process. A potentially productive patient journey through the criminal justice system is dependent upon initial assessment upon conviction. It is possible to undertake a series of steps which will be recorded as an ongoing digital record of the patient's clinical results and experience. After initial prison entry transition, screening must be undertaken by specialist providers for people with ABI, such as RBS, leading on to MRI scanning, the most efficient diagnostic tool for ABI, which can provide diagnosis leading to appropriate clinical treatment both within the criminal justice system and also on release. Understanding of the condition is essential within incarceration and also on release into the community, where continued support and treatment must be available. The journey for patients experiencing an ABI must not commence and conclude at the prison gate. Pre-release and post-release specialist teams create necessary strategies to ensure that the patient is supported and so preventing recidivism. To reinforce the positive diagnosis and treatments both pre and post-release, a digital solution entailing the clinical tracking of ABI individuals as they progress through the criminal justice system, from initial screening results to post-release care, ensures that no patients experiencing ABI are left behind. A simple multi-level cloud-based application can reference all data recorded at each level of assessment, i.e. screening, MRI results, clinician treatment, and pre- and post-release assessments. This allows a continuum of data throughout the patient's process, enabling clinicians, practitioners, and institutions access to both up-to-date and historical information in order to make informed and appropriate choices for a patient's welfare on an ongoing basis. The digital application gives ongoing observation, prompting relevant treatments, multi-level and real-time identification of a patient's potential risk factors, and so identify clinical solutions. With consistent post-release care, positive recovery strategies aid the individual in avoiding recidivism and maintaining employment and an independent lifestyle, with support given to sustain recovery and safety. Reintegration saves many thousands of dollars by intercepting recidivism and also helps to provide social integration for many ABI patients. A successful strategy begins with the identification of an ABI in the first instance, especially for those drawn into the criminal justice system due to their condition. Thank you for listening to this short presentation. Here are the references which supported this study.